Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam, Dato'.
Okey, sekejap Okey, kita mula dengan umur kita Al-Fatihah. Okey, alhamdulillah. Okey, so ini nak belajar neuro exam online kan. Okay, you guys year 3 you guys year 3 yang baru kan?
Ya, Doktor, kami yang baru.
Baru first week.
First week, Doktor. Ya, betul.
Okay, so macam mana kita nak belajar neuro exam online? You guys kena buka video. Semua masih nak semua buka video. Turn on your video. Okay, jangan pakai mask. Unless kalau you guys kat luar kena pakai mask lah. Nanti macam senang sikit. Okay, berapa orang semua sekarang ni?
Total of student 34 students. Yes.
34. Ada yang Darul Quran ke?
Ada.
Siapa Darul Quran? Angkat tangan. Mak sikit. Mana Darul Quran? Siapa Darul Quran? Saya suka budak-budak Darul Quran ni selalunya. Yang satu Darul Quran. Siapa nama? Perempuan lelaki?
Lelaki, Doktor.
Nama? Ada berapa orang Darul Quran kat sini?
Sorry, ada lelaki seorang, ada perempuan seorang kot.
Lelaki siapa lelaki? Lelaki yang mana?
Lelaki yang tu, Muaz Razi tu.
Siapa? Muhammad ni semua saya nampak kat sini.
Dia angkat tangan tu.
Ya, nampak mana? Saya nak, mesti nak tengok angkat tangan lah. Dia angkat tangan.
Ada klik dekat participant punya icon, nanti ada list name tu, and then ada sign atau icon angkat tangan.
Oh, okey. Okey lah, tu lah. Sorry lah, sini jahil sikit about teknologi ni. Okey, yang perempuan siapa yang perempuan?
Yang perempuan yang saya perasan seorang je, Siti Najihah.
Siti Najihah. Oh, okey. Bagus. Okey, good.
4
Okey.
orang, Doktor. Perempuan. Ada 4 orang lelaki. Saya seorang.
Oh, ya ke? Bagus. Okey, bagus. Hopefully you guys can guide us lah dalam kelas ni. Okay, anyway, so let's start dengan neuro exam. Okay, neuro exam ni dia sama macam exam lain. Okay, exam always start dengan inspection. So it's from the bedside, from distance, and then close inspection. Okay, you approach the patient and then do close inspection. Apa lagi? Inspection. Dia tak ada percussion, palpation, palpation, auscultation tak ada. So in general the system cuma beza dia neuro exam ni the main difference is not a one side punya examination. For example, like abdomen kan, we know we approach the abdomen kan. Kalau respi is respi, lung, cardiovascular is cardiovascular. But neuro you've got a lot of neuro exam. So in exam you can be asked to assess cranial nerve, you can be asked to assess motor upper limb or sensory upper limb, or motor lower limb, sensory lower limb, cerebellar, or in fact part of the neuro exam is developmental assessment. So you can be assessed on developmental assessment, or even you can be asked to assess a very specific, macam assess cranial nerve 3, 4, 5. Ataupun 9, 7, 8, 9 contohlah. Okay. Cuma remember in pediatric sensory is very rare. Okay, we don't do sensory as much because tak reliable. Okay, very difficult. So mainly are actually motor. Motor is the main one because our chunk of patient and the major chunk of patients are actually the CPs. Okay, the cerebral palsy. So these are motor problem. We do have some cerebellar, okay, but mainly motor lah. Is it the lower motor or upper motor? So today I'm going to focus on motor examination only, okay, upper limb and lower limb. And you guys about IM ke belum kan? Ni first block kan?
First block. IM kami second block.
Pernah buat examination, dah belajar examination kan?
Neurological examination ke? Pernah belajar lah masa preclinical years.
Pernah perform?
Ya, apa dia?
Pernah perform tak? Pernah perform neurological examination?
Tak pernah lagi. Tak pernah on practical. Rasanya belum lagi.
Perform tak pernah so actually I've got video tapi problem dia I tak tahu macam mana nak buka. Sebab this video dalam my phone. Sehari tu kita orang buat backside and then I suruh someone takat gambar, I mean record the video tapi I tak sure macam mana I nak buat. Any idea? Because the video is in my phone. Macam mana I nak tunjuk kat you guys?
The video is in WhatsApp ke ataupun?
Video dalam phone, dia bukan WhatsApp, dia dalam phone.
Oh, save dalam phone punya ni
macam mana? Sekejap, let me try again Okay, tak apalah, I just, we discuss the theory lah we discuss the theory. So how to approach? Okay, first from the bed end lah, from the end of the bed. Okay, look from distance. Okay, look at the patient. So what do you want to look at in neuro examination? What do you have to comment on neuro examination? Let's start dengan Siti Najihah. When you look at the child, kan, in your neuro exam, what are you looking for?
Specifically neuro exam, doctor. Developmental overview, mesti tengok buku lah.
Developmental, how do you assess that?
Tengok dia punya milestone, maksudnya kalau berapa years old dapat buat apa macam tu. Ni baru tengok.
It's difficult kan? Because patient is lying on the bed. Kan? So you won't be able to assess the development. You can assess part of development. Kita tak assess development, we assess like conscious level boleh lah. You just tanya, Dik, nama siapa? Then jawab. Then you know the patient is conscious. Kan, the airway is pattern, all the ABCD lah kan. Alert, not confused, kan, orientated. Then that's one of the thing yang you can assess. Okay, lagi? What else? Just by looking at patient, apa yang you boleh assess in neuro exam?
Posture.
Posture, good. What posture are you looking at particularly?
Badan sama ada scoliosis ke ada.
Scoliosis you tak nampak lah. You tak boleh nampak scoliosis unless you examine the spine. Apa? Posture kan? Whether is it flexure posture or is it fixed flexion posture? Atau patient looks floppy, frog-like posture. Dia nampak floppy lah, nampak stiff, nampak macam contracture. Okay, this can be part of the posture. Ataupun dia nampak epistotonous position. Okay, these are the thing yang you kena comment. Okay, lagi apa lagi? Posture lagi. Next, Mustafa Usama. Mustafa Usama, are you Malaysian ke apa?
From Egypt.
Okay. Do you speak Malay?
Sikit.
Oh, sikit. Then I'll speak in English then. Okay. So Mustafa, what you have to comment from the bedside when you look at a child in a neuro examination in a neuro examination station? What do you have to comment when you look at a child in neuro exam? Number one is posture. Then, besides posture, what else?
Gross motor and fine motor.
You cannot assess gross motor and fine motor just by observing observing. Because remember, in your exam, patient is lying supine. Okay, the patient is lying supine. Patient is not doing anything, kan? Patient is not doing anything. So how do you actually, what can you assess just by looking at a patient, at a lying patient?
Any
What else?
abnormal movement?
Abnormal movement, good. Okay. Okay, abnormal movement. Okay, dysmorphism will be later lah. You need to look at patient closely, then you can comment on dysmorphism. But abnormal movement can. Okay, what sort of movement are you looking at particularly? What sort of abnormal movement that you know of? Give me one example.
Seizures?
Seizures. Okay, good. Okay, there's no seizures. What else? Ahmad Fauzan, what are the abnormal movement that you have to look for?
I'm not sure.
Movement. What are the movement yang you tahu? Tak tahu. You ada seizure movement lagi? Anything else?
Eye movement Doctor?
Eye movement such as?
Dan
Penciling.
the lateral.
Okay, eyelid. Okay, but from far, I mean, because you are looking patient from the bad end, so from far, so it's difficult lah to assess the eye. So from far, what movement do you want to particularly look at? Just by looking at patient, you boleh nampak. What sort of movement yang you nampak grossly? Okay, you boleh comment on apa dia? Apa dia?
Repetitive movement.
Such as?
Kolea
kan? Things macam kolea.
Yeah.
So you have to look for that. Okay, kolea, ethitosis, lagi? Tics. What else? Apa lagi movement yang you boleh nampak? Tremors. And these are abnormal movement yang you kena look for. Okay. So bila you look at patient, okay, don't just simply look. Okay, look for all these findings. And then besides that, what else you have to look? You also have to look at the surrounding. Okay, what are there at the patient surrounding that can give you clues? Apa yang you boleh nampak dekat surrounding? That can give you clues.
Wheelchair?
Apa dia?
Maybe kalau ada wheelchair.
Ada wheelchair, good. Okay. So walking devices. Okay, walking devices. What else? Wheelchair. Then prosthesis. Okay, for example, if patient got prosthesis kan, or ada kaki palsu, okay, or got spleen. So these are the things that give you clues. Okay, what is the problem? Okay. For example, if you see a patient got a spleen, okay, leg spleen, foot spleen, then chances are possible patient ni got CTEV, okay, congenital talipes equinovirus, or abnormality lah, deformity of the foot or legs, or maybe this patient got contracture, so had surgery done or just given Botox and now on spleen to reduce the contracture. So these are the things that give you clues now. Okay, and then is the patient on oxygen? Kan? For example, if you got a child with SMA, spinal muscular atrophy, or a Duchenne, an advanced Duchenne, currently on home oxygen or on BiPAP or CPAP. So these are the things you can comment on. Okay, faham tak? So you can say the child is not attached to any oxygen or any ventilatory device ataupun any assisted ventilatory device. Okay, and the child, and then you boleh look at the breathing pattern. Okay, does it look in distress? Because it may be the child had ICP kan, had increased ICP leading to the coning lah, sign evidence of coning, Cushing sign. So ada breathing, Chinese stop breathing. Kita tahu kan Chinese stop breathing? Have you heard about Chinese stop breathing? A dying patient is always got Chinese stop breathing. Okay, read about it lah, read about it. Okay, Chinese stop breathing. irregular breathing due to autonomic punya problem, respiratory center punya problem due to anything lah, trauma to the brain or tumor. So these are the things you have to comment on. And then move to the patient. Come closely to the patient. Okay, look at the patient face. Okay, identify any dysmorphism. Okay, look at the head. Grossly, is it normal size, or is there any hydrocephalus or microcephaly, or is there any like obvious omaya ke, like obvious ada device ke kat kepala, kan patient ada shunting, ada shunt. Okay, these are the things you have to see lah. It's very difficult to describe online, tapi later maybe if you come for face to face, maybe if we met patient with devices macam ada VP shunt or VA shunt ke, or any omaya, then we can I'll show you lah. Okay, and then next is depends on the examination. For example, if this is a station, so let's start with lower limb motor examination. Okay, so we're going to learn lower limb motor examination. So now you have to approach the lower limb. How are you going to expose the child? Farhan Adira, how much do you have to expose the child for lower limb examination? From where to where?
Expose the only area that we want to examine.
Okay. What do you want to examine? Kalau kaki, how much you have, because you want to examine the lower limb, so how much you have to expose? Ideally from nipple to toe lah, ideally. Tapi in exam, you have to expose above the knee down to the toe. So you can make sure patient exposed. Remember, you need to make sure the patient is well exposed. Okay, now we're doing lower limb motor examination. So what is the first step? What examination you have to do first? Ikhwan.
The leg movement. Examine the leg movement. Examine the leg movement.
Okay. Before that, you can close inspection of the lower limb first. Okay. So what do you want to look at the lower limb? Now, just now you look at the general kan. Now you look at the lower limb closely kan. So what are you looking for? Ikhwan.
The thing that we used to check at the feet. Apa tu namanya, sentuh yang the feet thing. I don't know the name.
Apa yang nak tengok dekat kaki? Not only feet, the leg, the lower limb. Apa? Okay, you look at the muscle wasting. Okay, you look at the muscle bulk. Is there any muscle wasting? That's number one. Any muscle wasting? Again, sama macam tadi. Similar to just now. Any abnormal posture, especially in fixed flexion deformity. Is there any fixed flexion deformity? Or any patient in what? Any deformity lah. Is it in adducted position or abducted position, internally rotated lower limb, things like that. Okay, and then look at the muscle lah, muscle bulk. Is it wasted, cachexic looking? Okay, or is it there's hypertrophy, calf hypertrophy? This thing will give you clues lah on what is the diagnosis. To be honest, actually just by observation, you can actually you can get your diagnosis just by observation. Okay, later on, lepas tu you kena touch patient. Now touch, what do you have to do? You have to assess for fasciculation. Look at fasciculation. Okay, now palpate. You dah observe kan? Inspection, now you palpate. So palpate, first kali you kena palpate for the muscle bulk. Feel for the muscle bulk, especially dekat thigh, dekat calf. Okay, these are the area yang important untuk you feel for the muscle bulk. Is there any wasting or is there any ada hypertrophy ke tak? Okay, lepas tu, now you feel for the muscle bulks. Next is
Muscle tone.
okay. Next is you can proceed with the tone. But remember, you have to ask for presence of pain. Ada pain tak patient ni? So you can tanya, adik ada sakit tak? Do you have any pain? Tanya, okay. And dia kata, oh tak ada. Okay, now I'm going to move your lower limb. I'm going to move your lower limb. Ataupun I'm going, kita nak buat exercise sikit. Contoh. Okay, usually for lower limb examination, I will start with gait. They give you the most information. So you bertanya dulu mak dia. Puan, anak puan boleh jalan tak? Boleh. Then you boleh buat gait examination. So gait, so component of gait examination, first you suruh dia berdiri. Okay, adik cuba dia berdiri. Okay, berdiri tegak with barefoot. Okay, remember kaki kena expose up to knee, up to above knee, and then barefoot. Tak boleh pakai slipper lah. Then ask to walk. Okay, cuba jalan macam biasa, and then turn, pusing. Remember, you need two people. One person kena follow the patient just in case dia jatuh, and then the other guy, you as examiner, you examine lah. Okay, and then lepas tu, so first you look at so jalan, and then walk along a line. So jalan ikut line sepanjang garisan. Okay, walk along a line. Okay, lepas tu, sekejap. I'm sharing something with you guys. Kejap. Alah, tak pula. Hold on. I tak tahu boleh tak try. I nak try this.
Recording in progress.
Sekejap. Okay. So just now, so you boleh assess the gait. Number one, ask to walk. Okay, walk and then turn and come back to you. And then second, walk along a line. So just walk following a line. Okay. And then number three is walk on the line. Okay, so walk on the line. Okay, exactly on the line lah. So basically walk macam heel to toe walk. We call it heel to toe walk. Okay, on one line. But remember, this can only be done after 5 years old. Those yang less than 5 years old, you tak boleh suruh dia walk on a line because they won't be able to do it. Because gross motor punya development, walk on a line is only after 4 years old. Okay. Next is tiptoe. You ask them to tiptoe and then heel walk. Okay. After tiptoe, heel walk. After heel walk is you ask them to walk on the side of their foot, lateral side of the foot. That's the last test. Okay. So what are you looking at when patient walking? When patient is walking, what do you look at? Muhammad Faiz.
I look at the balance, doctor.
Okay, look at the balance. Okay, look at is there any imbalance? Okay, ataxia lagi. What else? You look at the posture. You look at the posture of the lower limb and upper limb. Both tangan dengan kaki kau. Look at both upper limb and lower limb. So you have to look whether is there any contracture or is there any
Myopathy, doctor.
apa dia?
Myopathy.
Your what? Pardon?
We look whether there is any myopathy or
Yes.
palsy.
Okay. Yes. Okay. Look at the by looking at the gate, you have to name the gate lah. You have to identify the gate. Is it antalgic gate because of pain, or is it hemiplegic gate because of the contracture and also hypertonia, or myotonic gate because of the myotonia of the proximal muscle or distal muscle. So you have to assess that lah. Okay, you have to read on gate assessment, type of gate. Okay. Next is, after that you ask patient to come back to the bedside. Okay, sit down, and then you have to do the usual examination. Okay, now you've done the gate. What else? Nurul Shahira. Muhammad Izul. Muhammad Izul. What else you have to ask? What else you have to do? You've done the gate now.
Maybe look for the movement during the children walking.
Okay, now you settle with the gate. Now what else? Lepas gate you kena buat apa? For lower limb motor examination.
Power of movement, doctor.
What? Pardon?
Maybe reflex.
Okay, now you need to examine the number one is tone. Always start with tone first. Okay, tone followed by power, reflex. Okay, tone together with clonus lah. Tone, clonus, power, reflex, and then you punya plantar, Babinski. Okay, start with tone. Okay, how you examine tone? First, to examine tone, you have to ask number one, is there any pain? Okay, that's number one. Okay, number two is you have to assess the proximal tone first. Okay, the muscle tone of the proximal muscle, then the distal muscle. Tone always start with proximal. Power lah. Start with power. Sorry, I forgot power. Start with power first. Okay, for lower limbs, start with power. First, flexion. You need skill lah. You need to practice because it's very difficult to ask children to actually to comply with your command lah. To follow what your order is. So number one is power. So you assess the hip flexion, okay, and then hip extension, and then knee flexion, knee extension, and then you assess the dorsiflexion, plantar flexion, and then the great toe extension. Okay, these are the things yang you can assess for power. And then tone, again the proximal tone and distal power, distal muscle tone, and then clonus. Clonus is part of tone, okay. Hypertonia will lead to clonus. Okay, you can get hypertonia with clonus or without clonus. Okay, sometimes, but if you got clonus, you will definitely have hypertonia. Okay, faham tak? So far okay kan? You guys understand? Kalau ada soalan, you can just ask. Okay? Sekejap. Done. Okay, so after power, you assess for tone. Okay, tone. Then after tone, you assess clonus, tone together with clonus, and then third is tone, power, reflex. Sorry lah, dia tone dulu, tone, power, then reflex. Dah lah. Anyway, so tone, power, then reflex. Last kali reflex. So remember for reflex, there's two reflex you have to assess. Number one is knee reflex, and number two is ankle reflex. Okay, remember, do not flex the limb, the knee, and also the ankle more than 45 degree. 40 degree is sufficient. You cannot acute angle. If you put it into acute angle, kan 90 degree, you won't be able to elicit the reflex. Okay, it has to be less than about 40 degree tu is sufficient. Okay, I rasa I tunjuk video lah, susah lah nak ajar macam ni. I don't think this is effective. Anyway, have you got any questions? Any question, guys?
Doctor,
Oh,
can you repeat
repeat what?
about the reflex?
Okay, reflex. In order to assess the reflex, number one, you cannot flex the knee to 90 degree. There has to be less than that. Maksud tak boleh fully flex the knee. It's sufficient just by 40 degree macam tu. Okay. So do the ankle. Or ankle and ankle you boleh, ankle you can dorsiflex to the maximum. Okay, that's number one lah. Number two rule is don't okay, number two is do not you need to hold the tendon hammer at the end, at the tip. Tahu dekat tempat tajam tu. At the sharp tip. Not at the middle or at the distal. At the end. Okay, hold it at the end. Okay, faham? Nanti I tunjuk, I tengah nak try share with you the video ni, tapi tak tahu, tak boleh lah. Mana benda ni? Kejap. If not, we can see video from Nina online lah. Because I already prepared this for the class. Sekejap. Sekejap. Tak boleh lah, I tak tahu lah mana video tu. Okay, hold on. Okay, boleh buat. Let's try. Okay, here. Okay, here. Nampak tak video ni?
Nampak tak saya?
Nampak.
Dengar tak suara? Tak dengar suara?
Tak dengar.
Apa you tengok je lah. Tak tahu lah macam nak kuatkan video. Okay, this one is upper limb Okay, let me just, okay lah, I cakap lah, you tengok the image, the video, and then I'll just cakap ni patient ni dia malu, so dia suruh tutup muka dia. So first, you expose the patient, okay, and then look at the upper limb. Okay, look at the upper limb. Okay, look at the surroundings, semua general inspection you should have done lah by now. Now closely look at the hand. Okay, look for any muscle wasting, abnormal posture, contracture, abnormal movement. Okay, there's none of them. Okay, now flip. Okay, you flip to look for fasciculation. Okay, just now I forgot just now. And then feel for the tone. Okay, this is how you feel for the tone. Okay, for the upper limb, just ask patient to shake your hand, kind of hold your hand, and then you just feel for the tone of the joint. Okay, but remember, ask the patient, is there any pain first? Okay, if patient got pain, then you cannot do it lah. Okay, now you assess the the power. Now you're assessing the power. Okay, now assessing the power. So proximal power first. So after tone, power just now, and now reflex. Okay, look at the reflex. And that's how you assess the reflex. Okay, the way you hold it is actually at the tip, remember, at the pointed side of the tendon hammer. Okay, so that's it for the upper limb. Now for the lower limb. So again, look for contracture, for abnormal movement, abnormal posture. You can look at the arc. Okay. And then inspect for muscle wasting. Okay, feel for fasciculation. Okay, check for fasciculation. But you have to flick you have to flick the muscle. Now check for the tone. Okay, that's how you do tone for lower limb. Just twice. Okay. Sepatutnya twice lah. Okay, this is to assess power. So this one, hip flexion. Hip extension. So this is knee extension and knee flexion. Okay. You do side by side. Okay. Do one side and then the other. Okay. Now you do the clonus. See the check got clonus kan? You can do the clonus together with the tone, or you can do with reflex. It's okay too. This is actually a child with spinal stroke. So they are the mix. Whenever, if the pathology is at the spine, you will have mixed upper motor and lower motor lesion. Okay, that's how you do the reflexing. You cannot do it, you cannot flex 90 degree though. I think 40, 60 degree is enough. See, you hold it at the end, at the end of the tendon. You know, you assess gait. This is what we call Lomberg test. Okay? Ask the patient to bring the foot together and then stand still and then close the eye. We want to assess whether there's any ataxia or not. Okay, first ask them to walk. Okay, walk normally lah. And then walk on the line. Along the line first. Okay, this one on the line lah. Okay, see, walk on a straight line. Then tiptoe. After tiptoe, heel walk. Heel walk. And finally is the walking using the side, lateral side of your foot, of your feet. Like that. Okay. Okay, kan? Okay, how was that? Nampak tak video tadi? Hello?
Nampak
You guys
Doktor?
dah tidur? Sleeping?
Nampak.
Clear, Doktor.
Clear? Okay, so you can see the flow, right? So that's how to do the upper limb and lower limb motor examination. Okay, so you will get examination, and for maybe in your exam you will be asked, okay, this child came in, this child had a fall, this child had an accident 5 years ago. So please examine the child's lower limb motor examination. Things like that lah. So you have to do examination. So that's how you do motor examination to assess the motor function. So at the end, your diagnosis would be, is it an upper motor neuron lesion or is it an lower motor neuron lesion? That's what you want to differentiate. Okay. Okay, what is the sign of upper motor, sign of lower motor? Yang tu you baca lah. Okay, ada soalan tak? I think that's all lah actually for this class. It's very difficult. I've tried in the past lah. What I did for your seniors is I divide you guys into groups, into smaller groups. And then we went to the ward, and then I did teaching lah. That's how the video come about actually. So I did so what we did is I bring one group and the rest sit at the seminar room. One of your senior actually record the examination for the rest to watch. But I don't think I have time for that because it's a bit packed lah, because we are quite busy at the moment. So to divide you guys into smaller groups, then it means I have to do like 4 or 5 sessions just for neuro exam. And neuro exam, there's a lot. Okay, you've got motor exam, you've got your sensory examination, and then your cranial nerve examination, cerebellar examination. I think it's better maybe in next time when you come to SASMAC for face to face, take opportunity to do examination. My approach for your group is your presentation for BST kan. For BST, your presentation will be focused will be exam based presentation. So I don't want like a 20-30 minutes presentation. Okay, I want you to present in 5 minutes. Your history kan, your clerking should be presented in 5 minutes. Then we can have like 2 presentation each session with 2 examination each bedside teaching. Is it okay? Okay with that? Can we try that?
InsyaAllah, Doktor.
So each BST session, we will have like 2 presentation, 5 minutes each, 5 to 10 minutes, 10 minutes each with feedback lah. Feedback then maybe like 20 minutes lah each. And then we can have 1 examination, maybe like focusing on neuro, or next time maybe on respiratory or cardio. Okay? Okay, ada soalan? I think that's it lah. Question?
Doctor, I want to ask, for like children who does not cooperate, like how do you do the cranial test and other tests, because it requires like listening to a lot of instructions, right?
Yes. Usually for babies kan, for babies or small children, will do it while they sleep lah. Bila diorang tidur, then you do it lah. You need to be opportunistic. And then for all the children, you need skill lah. Definitely in children, the toughest part is actually you need skills. Okay, you kena, for example kan, you can pretend like playing games. Okay, adik, hari ni kita nak main game, boleh tak? Okay, apa kata kita main game, main lawan-lawan. Okay, mau mula. Okay, so you ask them, okay, cuba adik kita buat macam, cuba kita menari. For example, you want to assess the motor upper limb kan, the proximal motor. Then you can say, okay, boleh tak buat macam ayam, buat kepak ayam. Then ask them to do kepak ayam. Okay, sekarang ni kita nak lawan Okay, cuba tahan, jangan bagi doktor tekan awak. Jangan bagi doktor tekan ni, nak tengok kuat ke tak ni. Macam tu lah. And you can play like that lah. It has to be a playful and enjoy things to do. Because children ni bukan macam adult. And then for example like lower limb kan, you nak assess the plantar power of the foot kan, the ankle plantar flexion. Then boleh tekan brake tak? Cuba dia tekan brake. Ask them to do plantar flexion by asking them to brake. Okay. Just imagine adik tengah bawa kereta ni. Okay, jom bawa kereta. Okay, cuba tekan brake. Tekan brake against your hand. Okay, against the power of your hand kan. And then things like that lah. Okay, main bola. Contoh you want to assess the knee extension. Okay, cuba adik sepak tangan doktor ni. Ask them to sepak your hand. Things like that lah. Okay, it is difficult, but that's the arts. Okay, ada lagi soalan? And definitely you kena practice among your roommates. What you can do is you have to practice, look at the videos and then practice among yourself. Make sure it's slick. You tahu the procedure, the steps of one after another, what follows. I mean, tone, power, reflex, clonus, and then Babinski. You need to know you need to familiarize yourself with the examination. Kalau you tak pernah buat, you nak buat, then it'll be very difficult. So I would encourage you to practice among yourself first. Try on adult, try on normal children, And then we can practice in the ward lah. Okay, boleh? Ada soalan last? Sorry lah, I don't think it's reach your expectation, tapi this is what I can do. Okay, any more soalan? Any more questions? Okay, kalau tak ada, okay lah. Kita tangguh lah. So let's end our session with tasbih kafarah untuk suratul Nas. Okay, assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you, Doctor.
Thank you so much,
Doctor.
Doctor.
Thank you, Doctor.
Thank you.
Thank you, Doctor.
Thank you, Doctor.